Hi, my name is Shayla, and tonight I'm going to argue against Medicare for All and why that might not be the best solution for the United States in their healthcare crisis that they have at the moment. My classmate argued that this would help solve the healthcare crisis by having people out of medical debt, and that a single taxpayer program would be better overall, and this would also bring people a peace of mind. My first piece that I want to talk about is that there was truly a lack of planning with Bernie Sanders when it did come to starting the campaign for Medicare for All. A study done with William Haso of Harvard said that there was a lack of planning over how this expense would be covered, making it not a very popular idea among the public. The New York Times also reported that state healthcare planning would be predicted to save about 8 to 12%, but in reality, once the calculations were truly made, it would only save about 1.6% of states in their healthcare spending. Because the savings of the states would get, it would mean much higher taxes that would go around as well, which I don't know about everybody else, but I definitely don't like high taxes. So this is also a big unappeal for Medicare for All, in the fact that you would also be paying way more taxes. The next point I want to come across is that a single payer program wouldn't be the best course of action. You wouldn't get a say in who your provider would be. You would get somebody that you may not like, that you have seen before, with a problem that you already currently have, and they're still not getting results that you need in order to fix the problem that you have. And this just isn't the best option. You don't get a say in who your provider can be. In an article that I found, a single payer healthcare, why it is not the best answer is what the article is called. Michael Diamond states that through his research, subject physicians would also have unwanted and unnecessary oversight by the government in healthcare decisions. This can be a huge problem when it comes to providing healthcare to patients, because now the government is limiting physicians in what they can and cannot do. This can make it very, very challenging for physicians to be able to treat their patients properly and in the correct procedure that they need to do. And the third point I want to come across is that this can actually cause more stress. There could be a problem being in unit, as most insurances do, and trying to find a provider for your health care. I know back in my hometown with Kaiser, the only hospital you can go to is about an hour away. So this can also roll over into Medicare for All and trying to find a provider that best suits you with your insurance being accepted. Elective surgeries are not covered as well, as to where elective surgeries in insurance provided by your work or personal are covered. I have a friend who recently just underwent a elective procedure that turns out it was actually necessary, and he was able to get that covered by insurance. And through Medicare for All, he probably wouldn't have been able to get that covered. And he probably wouldn't have been able to get the surgery because it wouldn't have been covered, and the costs are great. And in an article from the Hoover Institution, it states that you could also be denied from healthcare options. And this could cause way more stress for somebody in trying to get their healthcare figured out, trying to figure out where they can go, if their insurance is covered, if they even have insurance at that point, since they could be denied healthcare. So to wrap this up, I just want to touch back on the topics I just went over. There was a lack in planning when they started to campaign for Medicare for All, and that they didn't exactly plan where these costs were going to be covered, where these costs were going to be either in taxes through the states and savings, or just how the nation was going to pay for everybody's health care. The single taxpayer program isn't the best course of action because there are limitations to physicians through the government, and this could cause more stress among the physicians, and there is stress among patients as well, trying to be in unit, trying to find a healthcare provider, and trying to get those elective surgeries that are actually more necessary than they are elective, but are still deemed elective. This just makes it much harder to be able to get the help you need, get the insurance that you need in order to properly take care of yourself. And there are pros and cons to both Medicare for All and having regular insurance, medical insurance. But there are more significant cons to factor in. And in the end, the bad outweighs the good, making Medicare for All not an ideal health system for the United States to do for the future of their patients.